All right, everybody, welcome tonight. Appreciate you being here for Your Freedom Hub Presents the Free Market Cash Patient webinar. I'm your host, Jeff Cantor, along with my co-host, Charles Froman. We certainly would encourage you to attend all of these, and here's the site you'll go to be able to subscribe. It's very straightforward, yourfreedomhub.com/cashpatient. And Freedom Hub is the sponsor for this evening. As a quick little diversion here, let me show you where we're talking about. So over here, you'll be able to find stuff about consumers, information about the discussion we're going to be having this evening. This evening is available here as well. And then also all of these videos are going to be available to you on future viewing, depending on your favorite, excuse me, I'm going to open this up. Depending on your favorite platform, we're on BitChute, Brighteon, as well as YouTube. These are all the bit.lys and they are case sensitive. And just to kind of show you what that's looking like, here's the BitChute channel here. So you'll see there's quite a number of them on here. This is a little more recent channel. This is the YouTube. We're very new on YouTube, so we only have a handful. But we've been on the Brighteon platform for a very long time. You'll see there's a lot more videos in attendance there. So I appreciate your taking a look and see about what we've got going on. And then on that note, let's kind of dive right into tonight, because this is going to be a pretty exciting situation. So I'm going to have Charles take over here at this point and give us a nice little introduction.
Thank you, Jeff, and welcome, Dr. Arshad. We're very excited about tonight's weekly Cash Patient webinar topic because it really is a big step for us. Everyone has been looking for an app to tie the cash market together, and Jawad certainly has done that. And it has been recognized by the big brokers at the Ascent Conference. He got the Innovation Award last month. He is the CEO and the co-founder of WoW Health Solutions. He did run his own urgent care facility, so he got the real experience of running group benefits and what a hassle it is. And he has been an emergency physician for a long time and did run the department for that specialty at the Henry Ford West Bloomingfield, Michigan Hospital. So without further ado, Jeff, let's hear from Jawad.
Okay, very good.
Hi, Jeff. Charles, thank you so much, you guys, for putting this together. And I really appreciate the opportunity to, of course, speak to everyone about this. I am going to take control here. And give me 1 second. Let's share my screen. So I thought what I would do is we would go through maybe about 25 minutes or so of some slides, because we want to really put out the value proposition of why and then how, right? And I think those are the two main things that we're going to address, and really kind of get into that from there. At any point, please do stop me if you have any questions. Otherwise, of course, we'll open this up at the end with questions as well, and hopefully we would have answered most of them as we're moving through this. Okay. So as Charles was mentioning, I'm an ER physician by training, and I've been on the administrative side of medicine for quite a few years. And I decided that I wanted to really get into the delivery of care models, and what better way than to start your own clinic. Of course, that was sort of a rude awakening, not only because you're directly interfacing with our payer system, collecting funds from the insurance companies, but also you become a small employer that then is in the market searching for these benefits for their employees, right? So the lessons learned from those experiences really is the distillation of this platform, right? What we call WoW Health. Sort of a play on words, world of wellness, right? And our goal is to very simplistically connect the patient, the consumer, directly to the provider. And if we could do that on cash basis and cut out the middlemen, so to speak, we would be able to drive the best value for both the consumer and the provider, right? So we approach healthcare from a cost challenge standpoint, okay? because we know that people are paying a lot of money on premiums only to have to spend a lot more on deductibles, and no one is quite getting the value out of this process. And of course, high cost then leads to patient disengagement. There is a real feeling of lack of control that's not only felt by the patients, but the providers as well, right? So we said, we're going to come up with a scheme, with a mechanism that's going to recruit the providers back into taking care of their patient, right? And we do that three ways. So we tell our providers that we will not dictate pricing. They get to dictate what they feel is fair for the service they're providing. We will guarantee them that they get paid that amount, and we will never ask them to submit any claims or paperwork to get paid. But to be fair to our consumer, to our patient, right, we are going to include all of you providers into a marketplace. So now the consumer can really compare prices and distance and availability and make their decision based on those multiple factors whom they are going to go see, right? So it also brings this market competition into picture, which then protects the consumer from being charged too much. But we know that anything that is new, to bring scale to it, to really get it to grow, we have to bring in the incumbents from the existing system. And we'll give you guys some examples of how we do that to really help us grow. So what we're really discussing today and providing for you is a new paradigm of care, one which is truly patient-centric and patient-driven. And I challenge you every step of the way to keep that in mind, because you'll see that the patient at the end of the day is given the choice and the knowledge to make that decision, because every one of our members that's enrolled in one of our plans is given what's called a care plan. A care plan is a suite of services with a navigator. So they have 24/7 access to an actual person that they can call and speak to about how to use the app or how to make an appointment, or if they have a question about their program or their plan. We give them 24/7 access to telemedicine. So you actually have access to a physician that you can speak to. We give you access to counseling and behavioral health services, so psychiatrists and social workers and so on. And then we also enroll every one of our care plan members into a wholesale pharmacy program, where many of you may have heard of a company called GoodRx, right? They are the largest probably in this space, but our prices are going to be about 25 to 30% less than what GoodRx is charging, because our model calls for a monthly membership fee and there is zero upcharge from the medication. But we know that these strategies of providing some teleservices and so on isn't really going to address the bulk of what care is, right? The bulk of care is in person, and we split that in-person care into two main categories, right? So we say there's outpatient and routine care, anything that can be done outside the four walls of a hospital, and then there is the major medical stuff, right? Stuff that you get admitted to the hospital, God forbid you get diagnosed with cancer, right? You need inpatient open heart surgery, right? Those things are rare, but when they come up, can never be paid by an individual. So for that, we do need a product, a program where we are able to pool the risk of everyone involved and take care of our community. So when we started doing this, we wanted to really understand why we even need this alternative model. When we looked at data, we see that 9 out of 10 people that have a non-governmental insurance plan are getting it from their employer. So here is an incumbent that needs to be part of the solution that we are bringing, right, to really drive the scale that's needed in the market. When we look at the employers, that healthcare costs are the second largest line item on their budgets, right? So for example, GM spends more money on healthcare than it does on steel. Or Starbucks spends more money on healthcare than they do on coffee beans, right? So it's a huge pain point for the employers, and certainly something that they're motivated to take control of. We asked ourselves why people want health insurance, and presumably it's to protect you from financial ruin. But when you look at data, it doesn't pan out. It's actually quite the opposite, right? That healthcare is the #1 reason for personal bankruptcies in the US, and 75% of those people had health insurance. So just because you have health insurance doesn't mean you have health care. The two aren't synonymous by any means. And when you look at the other side of the equation, we see that providers are only collecting about 30% or so of what they're billing. So why am I billing $300 for something that I'm really going to end up collecting $70 or $80 for? Isn't there a better way for me to collect those funds in a more direct manner? So we always talk about scale because that is one of our driving factors, right? So when we look at scale, we know that there are close to, according to CMS, 1 billion ambulatory visits per year. Even when we take into account our high utilizers, we know that 5 out of 6 people still see a medical provider at least once a year. Right? So clearly there is a need, there is a lot of scale, and if we could come up with a great model, we could make this work. But we left off here because really the question beyond why is how, and I think that's what we're going to address, right? So when we talk about outpatient and routine care, we're talking about your office visits, your labs, your medications, your diagnostics, your CT scans, x-rays, ultrasounds, right? Your procedures, your outpatient procedures, that is, your knee repairs and hernia repairs and colonoscopies and endoscopies and so on. Right? All of these services can actually be fairly affordable if they are done on cash basis because you get a significant discount. So the question always was, where is the money going to come from? And of course, the simplest answer was, the individual could bring their own personal funds to the system. And that's great. However, when we look to grow volume and really bring the volume to the provider community, that's not good enough. Right? So we said, we're going to include the employer. And what if the employers could fund these accounts on behalf of their employees so that their employees could turn around and spend that money like cash, so to speak, on the platform? And that's great too. But we went one step further and we said, we're actually going to bring in some health plans. Right? We're going to bring in programs that are going to not only give that venue for outpatient and routine care to our employees and to our members, but they're also going to provide coverage for those major medical events, right? So in case you end up in the hospital or you end up having to go to the ER. Right? In that case, we're going to have some sort of a product that's going to assist that individual through those events. So we have 2 programs. We're going to really talk about one of them tonight. One of them is an employer insurance plan. This is an ACA, ERISA compliant plan, really meant for sort of larger employers over 25. Obviously, the larger the employer, the better the rate, right? Because these are self-funded plans. In these plans, what the plan does is that it actually gives money for outpatient procedures and all spending to the member. So instead of paying the doctor, they give the money to the employee. Now the employee can turn around and spend it like cash in the platform or within their community. But when there is a major medical event, then we revert back to a more traditional setup where claims are submitted by providers and hospitals and so on to the carrier, and the carrier adjudicates those claims and pays them out. What we're really talking about tonight, though, is this medical cost sharing program. The medical cost sharing program is brought to us through Health Excellence Plus. What we did in this case is we took a concept which has been around for 30 years, right, of medical cost sharing, really started with the Christian ministries, with Liberty and so on. And we have tied it to an ACA product so that it becomes compliant, and then allows us to really build an HSA with it, right? And an HSA becomes a pre-tax vehicle for the consumer, for that member to put money away, almost like a retirement. Actually better than retirement, as I would argue later. Right? So you put money into your HSA account, it gets invested, it grows. There is no expiration on it, of course, and you can use it at any time for your outpatient or even inpatient medical expenses. But if you have a major medical event, then you have that medical cost sharing community to assist you in those events. So that's what we're going to get into for the next maybe about 10, 12 minutes and really go through in more detail how that plan works. Okay. So this plan really has 4 elements to it, right? It's called the Health Excellence Plus program on WoW Health. The first element is your care plan. You're enrolled in this, we've kind of talked about it. You have access to the navigator, you have credentialed counselors and psychiatrists. We have tele-urgent care or telemedicine in terms of physicians, and you have access and enrollment into a membership for a pharmacy. The second element of this program that we will discuss is medical cost sharing. What does it mean? What are some of the terms to know? And how does it look practically when you think about, if you may ever need to use it? The third component, of course, is the preventive care, which covers all of the preventive services as required by the Affordable Care Act. And then the fourth component, and really in my mind, the sort of the most exciting of the bunch, is this HSA, right? And we'll kind of talk a little bit about what that is and what the advantages are. So when we talk about medical cost sharing, right, we have to understand that it is not an insurance program, right? It's not an insurance plan. That's why we would never refer to it as a plan, because somehow that, I think, confuses people into thinking that it's insurance, and it's not. What medical cost sharing does is a really cool concept where members contribute on a monthly basis into a community fund. And then when they have a need, money is dispersed out of that community fund for individual medical needs. Right? Now you may think, this sounds really good, but how could it possibly scale? Well, it's been around for a long time. As I said, it's been over here for over 30 years. There are over 1 million members enrolled in such a plan. To really understand how this works, right, we have to understand what are the value propositions of a system like this. So first thing is, you want to tell everyone that you are a cash pay patient, right? That's really important because that gets you that cash pay discount. I think we all have to understand that most every medical facility in the US has a separate charge master, so to speak, for cash pay patients, for self-pay patients. And if you tell your medical providers that, you are going to be able to realize that discount. There are no networks, so you can really go to any medical provider that you feel is appropriate and necessary for you. And this type of community is going to cover you for any acute injury or illness. But obviously for your routine care, you are going to be using your personal funds, right? And, and that's why we have the HSA as a pre-tax vehicle for you to put some money away in so that you can use those funds for your routine outpatient care. So when we talk about medical cost sharing, there are really 2 big terms that we have to understand. First one is this initial unshareable amount, or IUA. IUA is sort of, your good faith contribution towards your need, right? And we'll come to the next term, which is the need, in just a second. But basically, for any need or event that you may have, you agree to pay either the first 1,000 or the first 5,000. And then the remaining amount is going to be shared with the community who would assist you in paying that. Right? The second term to really understand is a need. And when we think about our traditional insurance setup, we are so ingrained into thinking about appointments and admissions, right? But really, if you think about it, in healthcare, a need is a much better way to ascertain if you need assistance or not. Because a need is, unlike an office appointment, it's actually an event, right? It can last for multiple appointments. It can last for months. So for example, if I'm having a sinus infection and I go see my primary care doctor, and then I go see them again, and then I see an ENT surgeon after that, and the ENT surgeon has to clear out my sinuses doing a procedure, and all of these appointments and medications and procedures end up costing me $6,000, well, that's considered one need, even though it's over multiple visits. right? And now if I'm enrolled in the $1,000 IUA program, then I am going to get the other $5,000 paid to me from the medical cost sharing company. The other good thing with the need is that once you are considered cured, once that need is over, you still have another 12 months in case you have a relapse, in case you need to be treated for the same issue. So you're not having to pay or put money out in that IUA for that event. However, each need that is unrelated is treated separately, right? So if you get admitted, for example, to the hospital for pneumonia one time, and then 3 months later you get admitted for abdominal pain, and the two aren't connected, then they are considered two separate needs, and you would be expected to pay the 1,000 or the 5,000, depending on which of the two plans you picked, for each one of those two needs. However, you are maxed out at 3 needs that you have to pay for per year as an individual and 5 needs as a family. So let's say if I'm an individual and I have a 4th need, well, that 4th need would be covered, would be shared with the community from the first dollar onwards. There is no IUA for that 4th need that I have to put out. Always the question is about pre-existing conditions, right? So I think the idea of pre-existing conditions really is that we want to set up rules not to exclude people, but to also make sure that we protect those who have been contributing into the community before they got sick. So what we don't want is, for example, someone who just found out that they got diagnosed with cancer, and then they decide to join the community, and within 3 months, they are getting hundreds of thousands of dollars in bills, right? So we say that there is no exclusion for pre-existing condition because we're not going to check for that. However, when you make a claim for a need, then there is up to a 36-month look back, right? So the community will look back up to 3 years and say, were you treated for this particular condition in the past 3 months? And if you were, there is no assistance from the community in the first year, but in the second year, you will get assistance of up to 15,000, third year it's 30,000. And of course, if it's over 36 months, if it's 4th year onwards, there is no limit in assistance. So if you end up needing that care for cancer and it started or it occurred while you were a member, right, you will be covered for that kind of assistance, and there is no limit, right? So even if it's $1 million, then that's what you're going to get. One of the questions I think to ask yourself is, do I have a pre-existing condition? Is, 3 questions, right? Have I been treated for a medical condition? Is it something that is an ongoing thing, or was I just treated for a sore throat, right, which is a finite issue? Have I been given a diagnosis of a medical condition? Was I just having some, twitching in my arm and no one ever really figured out what it was and it just went away? And are you having active symptoms from it, right? So whereas I just diagnosed with cancer because of the cough that I have. If you are managing your condition, if you have high blood pressure, diabetes, high cholesterol, what have you, right? These are not a barrier to join because you are going to manage your chronic conditions. And as long as you don't end up needing the community funds from a complication from those conditions, you're going to be fine. And once again, in the first year is the only one where there is no assistance. After that, you do start to get some assistance in 2nd and 3rd year, and of course, 4th year onwards, there is no limit. So that's sort of pre-existing conditions, right? So let's talk about an example, and I kind of mentioned one earlier about a sinus infection, but here is one about, gentleman, Tom. He's enrolled in the 1,000 IUA program, notices some blood in his stools, goes to the doctor, pays $125, the symptoms don't go away, pays another $125 for a second visit, goes sees a GI, the GI says, you need a colonoscopy, right? Does a colonoscopy, and the total cost for that event ends up being $2,900. So now we see that, Tom is responsible for the 1,000 because that was the program that he was in, and he is going to be and he's going to be paid the other $1,900. So from the community share. So let's go to the preventive services. As we mentioned, this is an ACA compliant MEC plan that's attached to it. So it is going to cover you for your preventive yearly exams, including your immunizations and the medications that are required by the ACA, screening procedures like colonoscopy for males over the age of 50, right? You get one screening colonoscopy, and that's going to be covered. Screening diagnostics like mammograms for women. And then, of course, there is a whole bunch of these listed services on the healthcare.gov website that you can look at as well. So to me, the most exciting part is the health savings account, because this really is kind of cool, right? Because it is the only triple tax benefit program in the US, because the money you put in goes in tax-free. And then when you invest it, it grows tax-free. And then when you actually take it out and spend it on eligible medical expenses, you don't pay any tax on that either. It's not something that use it or lose it type of a thing, right? It never expires. It grows like a retirement account. We invested in Vanguard and Dimensional funds. There are 7 target date funds as well. And of course, this is all done through Health Savings Administrators, which is the administrator of these HSA accounts. You can pay for all eligible medical expenses. You get a debit card in the mail, and that's how you can use these HSA funds. And it's super simple. I'll show you guys in just a couple of minutes how you can contribute directly through the app into your HSA account. Okay, so this is really sort of summary screen, right? Before we kind of delve into and look at what the app and the software looks like. So our Health Excellence Plus medical cost sharing program, it's available all year round with a monthly subscription, which means there are no enrollment periods or deadlines. There's no open enrollment or what have you, right? You just need to enroll by the 15th of the prior month to start your coverage. It's available to all adults up to age 64, and then we have individual and family coverage plans available. And it is a really great option, especially for small employers, right? Because it is something that a small employer can now provide. It's a venue for them to provide assistance towards healthcare coverage for their employees. As we mentioned, you have access to a pre-tax vehicle to build up a pool of funds that can then help you pay for your routine outpatient and even inpatient care. You are enrolled in the care plan, so you do have access to several services and suite of services. And then for any major medical event, there is a simple structure of the first $1,000 or the first $5,000 of the total cost. And then, when you compare this to a traditional insurance plan, you're looking at saving close to about 50% or so. So it's a huge savings proposition for our consumers. So this is sort of the pricing per month, which is inclusive of the medical cost sharing community fees, plus your minimum essential coverage or your preventive fees, your WoW care plan, as well as your enrollment into the HSA program. And this is also available on your app, so you can always look at this table to see where you fall and that kind of stuff. Okay, so let's get into what our app does and what it looks like. So I'm actually going to switch over to my phone and make sure that you guys can see that. Give me 1 second. Okay, hopefully you guys can see my phone. And as you can see, if I go into the App Store and I put in WoW Health, that's the first one, right? So the app comes up and you just download the app. So I'm actually have it downloaded already. So I am going to go to my app, right? And kind of show you guys how that's done. I was actually enrolled in the program. I unenrolled myself so for this demo purpose so that I could re-enroll with you guys in front of you so that you can see how it's done and how simple it really is. I am going to use so you can sign up through the website, which is right here, wowhealthsolutions.com, or you can obviously sign up through the app as well. So I'm just going to use my Face ID to get into my account. And that's what everyone is coming into, right? So you are landing into the app where you have your appointments. So if you need to make any appointment to see a doctor for any procedures, you could do that, right? You have your medical charts. So if you have, you can obviously fill in some of your information, but any visits that would be done through the WoW app with your doctors, those clinical notes would come and sit in there as well. You have a task folder. So during the appointment, if your doctor tells you, hey, you should get an MRI, you should get a CAT scan, what have you, then you have that opportunity as well. Okay, so I'm going to go into the marketplace because that's where you are going to find your major medical programs. Okay, so when I tap on that, I see that there is Health Excellence Plus is right there. If I tap on that, I'm going to come to an information screen. Okay. So if I tap on the general information, I'm going to be able to read a bit about some of the features of this program. There are videos here that I can watch, which kind of go over some of the terms that we just talked about, like what is an IUA, right? What are the principles of membership? Why isn't Sedera insurance? That kind of stuff. And then you also have some HSA videos, right? So they'll tell you about what are the advantages of being in an HSA and why would you want to put money away in that. And then the plan's cost is basically just a table that kind of shows you what the cost of the plan is going to be. It is age banded. So the top table is for the 1,000 IUA, bottom table is for the 5,000. And then you just pick the age that you're in and the type of plan that you're getting. Is it a member only, member plus spouse, member plus children, and so on. So I'm actually going to go ahead and enroll.
Dr. Arshad?
Yes.
One thing to mention, everybody, as you may have noticed, is that that enroll button only became active once you went through all of the information. So it was positive that the person knew what the program was about and couldn't just jump right to enrollment and not really know what they were buying.
That's exactly correct, Jeff. I'm sorry, I skipped that. And you guys will notice that the enroll button at the bottom was actually grayed out. And it will only become active once you have gone through the 3 top things. Once you've looked at the information, looked at the videos, as well as looked at the plan's cost, right? Because once you start the enrollment process, it's actually super simple, right? If you belong to an association, perhaps, and these are the 6 associations that are currently participating, you can pick one. If not, then you can just say not listed, and you can pick what type of a plan are you signing up for, right? Are you individual, spouse, children, and family? There is no limit on children, right? So it doesn't matter if you have 2 children or 5, you would be covered for the same price. So I'm actually going to go ahead and sign up for an individual plan, and it's going to ask me for my SSN number. And so I am going to go ahead and put that in. But I'm going to put it in. And I'm not a smoker, and it asks you if you have any medical conditions that you would like to put in, right? And I don't. Sorry. So I'm going to go ahead and hit next. This is our agreement.
One thing to mention real quick is it's not retaining the social security number. It's just using it for that purpose, and then it immediately blanks it out.
Exactly. So we don't store your social security number. It is strictly needed to create your HSA account because you'll get a debit card with it, and it is needed to send to the medical cost sharing to Sedera, right? But after that, we don't keep it, it gets expunged, which is why if you ever unenroll and you need to re-enroll, you have to put it back in because it's not stored. Okay. The agreement basically goes through all of the things that you should really read about and so on. You have some access here. So if you wanted to look at the membership guide, for example, for Sedera, you could tap on that and it would open this up, and you can read in really good detail about all of the things that you may want to know about the program. I'm going to go back to the app and hit I agree at the bottom, and then I'm going to proceed. And now it's going to give me two options, right? It's going to tell me I can pick either the 1,000 or the 5,000 IUA. I'm going to go ahead and pick the 5,000, and it's going to give me, it's going to start off with a $10 default into your HSA, right? I actually always put in more, so I'm going to put in 50. And as you can see, it changed it to 354. It's now telling me that this is the amount that's going to be deducted every month from my credit card. Now, these services are not eligible to be paid by your HSA, right? So those are some of the government IRS rules. So we tell you that select a non-HSA card to pay for this, right? And I actually have a few cards already loaded in here. As you can see, I'm going to use my Amazon Visa card. Of course, if I didn't, I could always just go to the new card, and we charge a 5 cent to confirm that your card is active to move forward. And once you hit that, it gets reversed afterwards. But in case I already have my card saved here, so I'm just going to move through there. And once I hit proceed, it's thinking, and there you go. And oh, and I got a text message as well, right? So I've been enrolled in the care plan. Will receive an onboarding call from Health Excellence Plus. My activation date, because I enrolled before the 15th of February, it's going to be, activation date is going to be March 1. Right? And I'll be getting my HSA debit card in the mail. Right? And I hit OK, and it brings me back here, and now I'm all set. Now, if I go back into it, you'll see that my enroll button is open, but when I tap on it, it actually brings me to my enrollment details, right? So it tells me that I'm in the 5,000 IUA plan, individual, my plan cost is $304. I'm putting in 50 right now into my HSA, and I can always update my HSA at any point, right? And for the next month onwards, it will start deducting that extra amount. And then obviously you have the opportunity to cancel your subscription if the need be, and once that period is over, so this is March 31st, if I cancel it now, it will keep me enrolled for the month of March, but effective March 31st, it would unenroll me. And that's really it. I think you have your wallet in here, so you can always add money into your WoW account if you want. So it gives you an opportunity to put money away, maybe $5, $10 a month, and allows you to sort of build up a balance that you can use if needed. But it also allows you to put in your cards that you may need to use in the future. And this is obviously where, when you get that HSA debit card, you can just attach it so that any transactions that you do through your WoW app is going to be covered.
Dr. Arshad, why don't you explain for a minute what happens when I'm a consumer? I'm going in there and now I have this and I want to book an appointment. What's happening with money? And one thing too, if I have an HSA, I can actually see the current balance. So when I'm about to do what you want to describe here, I can see what monies I have available to me to be able to pay. But right. let's show everybody how cool this is in terms of how it makes the market work.
Yes. So to your first question, Jeff, the reason we can guarantee our providers that are on the WoW platform their payment is because when you make the appointment, when you buy something, we are going to take that money and put it into an escrow account. We don't give it to the provider. Of course, it sits in the escrow account until you have had your service, and then we release those funds. And that way, the provider doesn't have to wait, and they are guaranteed their payment, right? So that's sort of how we do that. And then I actually don't have my HSA debit card, but if I did have that loaded in here, then and it was sitting in here, it would actually tell you what your balance is in there. And so we're in the process of finishing that back-end integration with health savings administrators so that you always know how much money you have in your HSA account, right? So that really makes it simple for you when you are doing any of these things. So we have, just to kind of show you guys one last thing, right, is that we do have a web page right here on our website called the MCS program, right, the medical cost sharing program. And everything that we talked about today has been broken down into 4 videos, right? We kind of tell you that there are 4 elements to your program, as we mentioned. And then these videos, the total length for all 4 of them combined is 14 minutes, right? So if you watch these 14 minutes, you will understand what is medical cost sharing, what is the WoW care plan, right? What are preventive services, what is an HSA account, and how do you enroll, right? So it's going to give you all of that information so that you are ready to join our community.
Very good. Now, one other thing to mention is, this is all excellent and, everybody's got to let this sink in for a little bit. But, one of the things you mentioned is that, now we're going to be paying cash, there's discounts and so on. And obviously cash pricing's been around for a while and there's more of it. But, that's just sort of like floating out there in left field. Nothing really seems to be happening. There's no like interaction between the fact that there's all these various cash prices. Why don't you explain for a second how this app actually forces the market to work? And my example is when you pull to a corner and there's 4 gas stations and 3 are the exact same price, but one is 10 cents less and there's an enormous line out of the door. That particular one is forcing the other 3 to face reality. So what's this app doing that sort of matches that situation?
Yeah, so I'm actually going to, great point. So I'm actually going to move into our demo environment just to kind of bring that home. So this is a dummy account and obviously does the same thing. In your appointments, you can see your upcoming appointments, you can see your in-progress appointments and so on. But when I go to create an appointment, right, and I'm searching for a physician and I can search them by specialty, for example, right, but it's going to list those physicians that are in my area, right? And now, based on the price that I am, oh, you know what? I'm so sorry. I didn't realize that you're not able to see my screen. So I'm going to actually go back to my phone just so you kind of see what I was talking about. So we were here on the homepage, right? And then if I go into the appointments, I can see all of my upcoming appointments. Then when I create the appointment, I can search for a physician by specialty. If I just go into the system, I can see who are the physicians in my area that are participating, right? So this is the advantage of course, being part of the ecosystem as providers, because you are going to be visible to so many consumers who are all sort of working on that same premise of wanting to pay cash for your services. But you can see where the physician is located. You can see how much they're going to charge. You can actually even read a bit about them. So that sort of is one way to bring everyone into one ecosystem, one thing, right, where you are going to be able to compete with each other as providers and as consumers really have the visibility that's needed to really get your care.
Okay, very good. One thing also to point out a little bit too is that, as far as when you say compete a little bit, what this also allows is that, say, I've always been a cash doctor. So, I've always been excluded from the medical world because if I was a regular doctor, quote unquote, regular doctor, I'm in Blue Cross's network. So I get all kinds of business, but I'm a kind of a naturopath doctor or some other kind of doctor, I'm not in anybody's thing that's feeding me business. I'm forced to find all the business by myself. But now that I'm in here and someone's looking for such a thing, they're able to be found for the first time too. And that by default, by having them in here, that kind of puts them on parity with any other kind of doctor, because your system doesn't look at anybody's being too tall or too short or whatever. Everybody's in here standing on their own 2 feet. And if I'm the consumer with money in my pocket to spend, I get to pick what I want to go to. So no one's kind of controlling my health choices, and I may want to do a mix of others. And then for the doctor, let's say I'm in this list and there's 6 other doctors just like me in town. Well, you know what? I got a special thing I do. I got a 2-day weekend getaway thing that I do for people. And now I can promote that a little bit and rise above my competitors by offering the consumer a better dollar value and a better thing to take advantage of for their health, which really changes the dynamic of healthcare in America, because as you and I have discussed, healthcare and the options in America are great. It's how we're paying for all this stuff and how we're connecting to it directly is where we've always been amiss.
Yeah, exactly. And so I just wanted to kind of show everyone that, so medical practices, your doctors can come up with these membership plans, right, that you can purchase sort of, so, that 2-day retreat a physician may be offering for health cleansing or what have you, now gives you that opportunity, right, to be able to come up with a plan that makes sense. And that's something that the market would want. And then once you as a consumer can purchase that plan, now you can take advantage of it.
And I think you maybe said this, but just to get back to that phraseology, the charm of this too is that when the person arrives at the doctor's office for the first time in history in America, they show up prepaid.
Yes. Isn't that amazing, that you actually get you walk in to your doctor's office and you're prepaid, right? So all they need to do is take care of you. They don't need to ask you for questions about, your demographics and collecting your insurance information and whatnot, right? I mean, I think it's really revolutionary when you think about, that from that standpoint.
And it's so straightforward because it's just like everything else. I may not be prepaid for gasoline, but when I get it, I pay for it on the spot.
Exactly.
And in this world, for some reason, somehow it became, I'm going to give you service, and then I'm going to just be the person to chase around forever to figure out how to get paid, as opposed to just doing it like every other business. So let's open it up for some questions here. Some hands are starting to pop up. Charles, I see you've got yours.
Yes, Jeff. And Dr. Arshad, what are the 2 or 3 points to mention to a specialist or doctor? What is the advantage to setting up a profile in your app?
Yeah, so of course, the first one is that you are going to get prepaid patients, right? You are guaranteed the payment for the service that you've listed, and you will never be denied or have to file a claim to get that payment, right? And then also the payment is in, sort of speak real time, right? Because the day the appointment is completed, your funds are marked for release. And so we do a weekly release of funds, so you'll get your payment within a week for that service, right? So, so I think, and it just becomes a really attractive, another stream of revenue, as Jeff mentioned, get exposed to individuals and patients who really are not necessarily in the traditional health insurance market. But really, I think our goal has always been to drive volume, right? And we drive volume really by bringing in the employers and bringing in these health programs and the insurance plans and so on. Because now we can really start to get that consumer side built up, which then of course makes it more attractive for the providers, right? For that doctor to want to actually put in the effort to be part of the system.
One of the nice advantages for the employer, like you're describing, is the fact that, if I'm able to switch either from that large group program or that small medical cost sharing, I'm going to save a lot of dollars. So I'm going to free up some money. So in the smaller one, the employer can put some money in that health savings account for my employee. And then also I can put some money in that person's wallet, just straight money into that in either of the programs. So now guess what? Because the average person who, would like to get a salary increase, but because because the health insurance is so costly and they never typically use it for the most part. They're not sickly on any regular basis. So it's just a big hole in their paycheck. Now they can have the option of more money, but what's even more important, because the employer is putting some money in advance, now when that person has those small things like you described, they never have to reach in their own pockets. So it's almost like it's a zero cost program to the consumer as a consequence of that. It makes for a fantastic situation. Now, we did have a couple questions that popped in, so let's address those real quick, and then we'll get some more with some hands raised. Somebody was asking, pertinent to, and let me go back to the chat window here, about the way that the health savings account works and how all of this. So let me read some of these questions and I'll respond, and you can answer too a little bit, Dr. Arshad. For an employer, how does the plan become ACA compliant? And again, he's talking about the smaller medical cost sharing. The HSA is only allowed in a high deductible compliant health plan. How do you comply with that? And what's the difference between this program and trying to direct with the cost share? Well, with the cost share by itself, it's kind of like if you had a car and in the trunk there's a spare tire, but now I didn't give you the car, I only gave you the spare tire. So the medical cost sharing is more about, well, what if I have a heart attack? Well, when was the last time you had one of those? But are you going to get a sore throat? Are you going to need to see, get your eyes checked, or a whole battery of other things? Do I want to make sure I'm eating properly? Where are my medical records? What if I need to talk to somebody in the middle of the night on a Saturday? So the idea of the whole idea of being the Swiss Army knife of everything you need, not just the emergency things I need, but everything I need is consummated within inside this program. And by having minimal essential coverage component, which is in and of itself a high deductible program, which is therefore HSA compatible, allows this to give you the best of both worlds, where I'm ACA and ERISA compliant, but I also have the medical cost sharing to keep my costs down in terms of my monthly charges in case something catastrophic were to occur to me.
Right.
The HRA is a little different. That's the one, and then you can address this one a little bit, Dr. Arshad. That's going to come into play in the 25 and up or 50 and above program. That's the self-insured employer-driven one. That's definitely run by a company, not bought individually. The medical cost sharing is available as little as one person can buy in, or a company of 2 or 3 or whatever. So the little companies that typically never get to do anything, they've got a golden opportunity. But any company that's of any size, 20, 30, 40, 50, and all the way up to thousands, they're going to be more interested in this one. So here's the question for you, Dr. Arshad. That HRA health reimbursement account, where the employer gives the employees dollars to spend as a reimbursement account, people have to submit their health claims to the employer for reimbursement. How does the app handle that third-party administration process?
Yeah, so that's actually really interesting, right? Because we built this plan, and it was this particular plan, how it's built, is what we were given the innovation award, as Charlie mentioned at the beginning, at the Ascend conference, right? So basically we did is we took your traditional health insurance and tore it apart, right? And then put it back together, right? And we said all of the outpatient and routine care is going to be paid on cash, but the cash is going to come from an HRA account, which is administered through an HRA vendor, which does the same thing, where the employees actually get a debit card in the mail. And so the debit card comes preloaded, for example, with $500, right, for an individual, or $1,000 for a family. That is your money to use, no questions asked. Use it when you want and where you want, where HRA is accepted. Now, on the other hand, if you have any more needs, then you have to go through the TPA to get those funds released. But you have $20,000 as an individual that's earmarked, and up to $40,000 as a family for these outpatient services. If you end up in the hospital, if you have one of those major medical events, if you have, got diagnosed with cancer, for behavioral health services, dialysis, all of these really high cost things, that is covered through a stop loss program, right? So that's where the insurance part of it comes in. So that's how we manage the HRA funds. It's really through Infinisource. They're the largest HRA vendor in the country, and they basically allocate funds into the HRA debit card on behalf of the employer for their employees to use.
Very good. Now here's another one. How do you handle referrals for laboratory testing, imaging centers, and so on?
Yeah, so those are pretty straightforward, right? So for example, if you need to make an appointment for an imaging center, right, you just go to the appointments, you pick the imaging that you need. It kind of walks you through the process. And then if you are given a prescription by your doctor for that study, you can take a picture of it and send it. What happens is that now you will get a call from the imaging center itself, and they will kind of walk you through it and, you know, decide on what the date and time for your particular study is going to be. You know, Jeff, it's amazing whenever you tell providers, whenever you tell medical offices that you're a cash pay patient, right, that it's just amazing how quickly you can get in. We're based in Southeast Michigan, and the average time to get an MRI, for example, it's about 2.5 weeks. If you are cash pay, it's less than 24 hours. So it really, I think, helps you as a consumer, not only to have the visibility, but also the expediency that's desired.
Well, also by using this route, that gets that place kind of Pavlov's dog to enjoy the idea of that cash consumer. And suddenly that's the person, as they already are taking precedence, but suddenly they're going to want more of them. Here's a couple that came up that I can answer here. It says, what if somebody already has, you know, health sharing such as Health Excellence Plus already? Can they be integrated into the program? Well, to answer that in a couple ways. One, there's more than one variation of Health Excellence Plus than we showed here tonight. So anyone that already has it or bought it for a different reason would very readily want to be a participant in this, because how are you going to find a doctor to go to? How are you going to book the appointments? So this is integrative into an existing client, as well as anyone that bought a different version or that already has some other program altogether. What if I have MediShare or Samaritans or Blue Cross or whatever it may be? Anybody that's got any other kind of health program is going to definitely want to take advantage of that. And somebody was asking about if we covered the major medical ACA compliant plan, and yes, we did. That was that whole latter portion that Dr. Arshad was going over there. That's the program. Now, when you added in, let's say when he went from $10 to $50 going to the HSA, that was increasing the monthly amount. So the program had a price based on your age, and if you were in the 1,000 or 5,000 version, and then whatever you were going to add to the cost of your health savings account, it was just going to bump those prices accordingly. So here he's bringing the chart up right here. So if we take a look at the one where let's pick the easiest one. It's an employee.
Sorry.
Oh, back up one sec. There you go. 18 to 29, employee only is $333 a month. Okay. Well, if I put $50 in my HSA, then it's just going to raise this price by $50 a month. That's what the app is going to collect, and then it's going to disperse that out accordingly. Now you get the control, like you said, how much is in or out of that HSA at your discretion. But again, everything's usable and workable through the app. So for the consumer, it's nice and simplistic. All right, I got another question here. And I'm forgetting who's on Galaxy 10. I think that's Mark.
Yes, it's Mark. And you know what, Jeff? You just answered my question.
Fantastic.
Yeah, so I won't even ask it.
Okay, well then I see there's another one in here. Hold on one quick set then. I think that Conti had his hand up there. Did you not?
Yeah, I think so. So Conti is asking if the 333, for example, covers the major medical. And yeah, so 333 includes your preventive services, your HSA enrollment, your WoW care plan enrollment, and your enrollment into the medical cost sharing community.
So yes, everything. That's the whole kit and caboodle out the
all
door.
Inclusive, one price.
Right. So it makes it convenient because again, the consumer's getting in. Instead of having to buy, I got to buy this and I got to buy that and I got to buy this and I got to buy that and I got to have this app and that phone number and all these just separate things. And what's nice, it's all delivered at the consumer level with a little key fob. So they got a phone number to call whenever anything happens, and then they got a scan or a padded QR code to be scanned so that all your medical records are visible to a first responder. So it's all the way down into the weeds to try to cover every little bit of minutia that might come up. Conti, I think you do have your hand up, and I have you unmuted.
So I am getting some sort of a a health insurance plan with very high deductible, which is
No,
HSA
no, no, no.
compliant, right?
It's a little
No?
confusing. No, here's how it works. There's actually three components. There's all of the wellness, the 24-hour day doctor service, the medical vault, the global medication, the personal concierge.
I
Then
got
there's
all that. I got
all of
that.
that.
Yeah.
And then on top of that, you have a preventative services program, which that is high deductible for a couple of key things that typically no one ever uses, because if they needed to use those things, instead they would use the medical cost sharing. But because they are built inside the 64 minimal essential coverage requirements of the Affordable Care Act, that qualifies it to be high deductible, which makes it compatible for a health savings account. However, if I had an issue that I would normally want to go to the hospital that's over $1,000, I would not utilize that feature. I instead would tap into the medical cost sharing, where the most I would be exposed to pay out of my pocket is either $1,000 or $5,000. Even if the bill is $10 million, the most I'm going to have to spend is $1,000.
So the only insurance in the whole system is the stop loss insurance, nothing else.
No, that now you're confusing it with a different program. I'm describing the one that's under 50, over 50, the large employer one. That has a stop loss. That one has a stop loss feature built into it. Otherwise, it's a self-insurance program.
Right. Okay.
So
it's
two
a self-insured
things.
program. So there is no insurance through any major carrier. It's a self-funded plan.
Correct. And Dr. Arshad, would you add to that? Is that basically the correct answer?
Is that a group self-funded plan, or the self-funded for each individual large group, or is it the entire population under this program?
Gandhi, I think that, you know, we don't want to get confusing. I just want to be clear, which plan are you talking about? Because remember that there are two programs, two separate programs, right? One doesn't meld into the other, okay? So the first one, which is the self-funded insurance plan, is an employer-driven process. An individual can't enroll in it by themselves. The employer must start the process. It goes through a fairly rigorous onboarding process, right? It takes about 60 to about days for it to come on board, okay? That is not what we're presenting today. What we're presenting today is an individual-facing medical cost-sharing program. The reason we bring up the other one is because we want everyone to appreciate that we're building a marketplace that is not only going to have 5, 10, 20,000 members, but really is going to have millions of members, right? Because your large employers now have a venue to participate in the same marketplace using the same features and services that you as an individual can get through the medical cost sharing program.
Okay, so what we covered today applies to individuals and small groups, like you said, 25 employees.
That is correct.
Okay, that's fair enough. Because I was thinking, if I wanted to look at a large group over 50 or over 100, how does that work? So you didn't talk about that today, which is fine. Which is fine.
You know, we kind of had to just cover just so much territory today, and already look.
I'm okay. I'm okay with that.
And we're going to get to that. And in fact, let me kind of give you some conclusions. I'm going to answer our last couple questions here, and then we're going to kind of have to conclude, unfortunately. But we'll certainly continue this ultimately. Someone was asking, how does this tie in with a direct primary care physician? And it does, and it doesn't in one respect. The Health Excellence Program, the small employer, this medical cost sharing, is the one that would be appropriate for a patient of a direct primary care physician. However, to kind of keep this simplistic, we've selected the version that's health savings account compatible because that's so good for that consumer. But there is a version of Health Excellence Plus that is designed for direct primary care physicians. So in this instance, the person would typically buy that outside of the app, but then they would put the app on their phone because this is how they're going to therefore book the appointment, and the direct primary care physician, of which this is tailor-made, would be able to put themselves in this app and be available to their patients and to get new people. We will be expanding those health options as time goes by, but because we're kind of in that crawl, walk, run approach, you know, we're trying to start out, keep it real simple so we don't confuse consumers, because as you can see, even just from today's call with just 2 programs here, you know, that already starts to create a little confusion. So that's really where that kind of goes. So on that, it's good for everything. If someone's asking, does a physician not get a rudimentary EMR suitable for documenting the essential information needed for continuity of care, rather than the overly complex information needed to justify an E&M code?
Yeah, so I just responded to that as well, right? Because I don't know how much time we have, but I can certainly show you a quick interface.
No, but I was going to say, we're going to try to do a follow-up. I mean, this is good that we're stimulating this level of questions, and you can see how effective this is to make the market work. So we have some special information we're going to be able to share with everybody at yourfreedomhub.com that we've put together, because as Dr. Arshad was showing, you know, some of the ways to get on there, there's actually some special ways we've created for everybody that's participating today. So we're going to certainly want you to follow up in that regard with us. And as a consequence, we're going to be able to kind of get some really interesting tie-ins for you. So on that note, I definitely want to thank him for participating with us today here.
No, thank you. Definitely, we appreciate it.
Yeah, it was very, very good.